Hello, my name is Karen Kiefer. I'm a nurse practitioner at St. Barnabas Medical Center Stroke Center, and today I'm here to talk to you about high blood pressure and strokes in the Hispanic population. Race does matter. Hispanics compared to Caucasians have differences in blood pressure and their risk for heart attack, heart disease, diabetes, and death. 24% of Hispanic people have more poorly controlled blood pressure than the general population compared to Caucasians. 20% are considered obese or heavier. 50% have a higher death rate from diabetes. Hispanic women with high blood pressure is twice as likely as men to achieve blood pressure control. So let's think about this. Let's intervene. There's an increased number of stroke deaths in the Hispanic population compared to other populations. Let's explain why. The prevalence of high blood pressure in the Hispanic population is right here. We can make a difference in this. This is Hispanic adults that we're talking about. Now, the percentage of blood pressure under control in Hispanic adults is quite low. If you look, it's not quite 20%. Now, to make these changes, we have to know what blood pressure actually is, what high blood pressure is, and what happens with it. Now, blood pressure is created by the circulatory system. It's comprised of arteries, veins, and capillaries. Now, the arteries are high pressure. The arteries carry blood through the body at a higher pressure. If you take a look, see this red? That's an artery. It pumps the blood away from the heart. Now, the veins carry blood at a low pressure, or they drain. And capillaries are a tiny network that promotes circulation throughout the body. Blood actually transports oxygen and nutrients. It cleanses the body by removing waste or metabolites, and once it's clean, it puts it back into circulation. Now, the blood pressure itself results from a series of two forces, a systolic and a diastolic. The systolic force is the force it takes to pump the blood out of the heart. And the diastolic force is the resting force in between the heartbeats. So when you're in your healthcare provider's office, they'll say, your blood pressure is 120/80. So what does that mean? 120 is the systolic, or the pressure that it takes to pump out, and the 80 is the diastolic. Now, high blood pressure occurs when there's an overabundance of pressure in your arteries. It affects all body systems, not just the brain, the heart, the eyes, the kidneys, everything. When the blood pressure gets too high, it decreases the flexibility or elasticity of the blood vessels. It's got the potential to tear. It also weakens them, and it places a strain on everything. Now, this is called a dissection or a tear. It can occur within your blood vessels or your arteries, both internally or externally. And when it tears, as you see here, it's got a potential for a blood clot to hide in there. And at any time, it can shoot out and cause a stroke or a heart attack. And the same on the external. Now, if you look at this blood vessel, it's narrowed by cholesterol buildup. You see that? And cholesterol is the sticky substance that lines your arteries. And not only does it cause the blood to have to pump through at a higher pressure, but as it pumps through, there's always a potential for blood cells to cling to the walls and eventually block it. Some of the complications of high blood pressure include a stroke, a heart attack, kidney damage, damage to your eyes, or retinal damage. Every body system gets affected. So how do we stack up? The difference in the 10 leading causes of death in non-Hispanic white Americans, number 5 and 6 are diabetes and chronic liver disease. Heart disease is number one. Okay, let's take a look at high blood pressure. It's in there too. We want to make a difference. Okay, look at Hispanic population. Cancer is number one, heart disease number two, diabetes 5, kidney damage is 10. We want to change this. We can change it because you can change how you live your life and how functional you are and how enjoyable it is. Numbers count. Like I alluded to before, when you talk to your doctor about your blood pressure, what does it really mean? Normal is considered less than 120/80. And an elevated blood pressure is anywhere between 120 to 129/80. They sound pretty normal to me. However, if you think we're trying to help you stay healthy, we're trying to decrease any risk for health factors. Now, they stage the blood pressures, the high blood pressures, into two stages. And stage one is when we recommend lifestyle modifications like weight reduction, smoking cessation, a low sodium, low cholesterol diet, a decrease in alcohol consumption, and exercise. And high blood pressure stage one is 130 to 139, 80 to 89 diastolic. That's how it gets started, okay? However, should you progress to where your blood pressure is 140/90, you're already in stage two, and medications may need to be started. Remember, the guidelines are targeted to prevent stroke and heart attack early. The earlier we can intervene, the better, and the healthier you are. What is a stroke? A stroke is an interruption to blood flow to the brain that causes damage due to lack of oxygen and nutrients. There's two different types of strokes. One is called an ischemic, and one is called a hemorrhagic. Now, the ischemic is where there's a blockage that interrupts the blood flow, and it's 87% of all strokes. Now, within this ischemic stroke is something called a TIA, or a transient ischemic attack. That is a major sign of an impending stroke. Some people call it a mini stroke. I view it as a medical emergency. A hemorrhagic stroke is caused by where blood vessels in your brain bleed, and that's 13% of strokes. Stroke is the fifth leading cause of death and the leading cause of adult disability. Now, what's disturbing to me is the incidence of stroke-related deaths in the Hispanic population is rising. As I said, there's two different types of strokes. There's called an ischemic stroke and a hemorrhagic. The ischemic stroke is caused by a blockage, such as a blood clot or cholesterol buildup, and that's 87%. You see how it blocks the blood flow? And the hemorrhagic is caused by high blood pressure or an aneurysm, and that's 13%. Causes of the ischemic stroke are different. There could be something like a thrombus, an embolus, or a blood clotting disorder. A thrombus is where a blood clot forms within the blood vessels and travels up and blocks an artery. An embolus is where a particle travels, like a piece of calcified cholesterol, a rigid particle like from an infection, from like an infected valve, where it becomes so rigid it breaks off and travels, or a blood clotting disorder that interrupts the blood clotting for you. A transient ischemic attack is a warning sign before a major stroke, where the blood flow is interrupted briefly and temporarily have symptoms of a stroke and then they go away. It is a medical emergency. I want you to call 911. I want you to get worked up and tested. Can we intervene before that stroke happens? It's so important. I want you to take it seriously. Furthermore, to understand what a stroke is, we need to understand what the symptoms of a stroke are. They would be a sudden onset or something very new for you. Things like trouble with your balance, where you can't stand up straight or you're leaning to one side. You're walking to the side, you're staggering. Eyesight problems, double vision or blurry vision, or you can't see out of one or both of your eyes. Some people have said that they felt like a shade was pulled down. F, facial droop, where one side of your face is higher than the other. Or when you're drinking something, it goes out of your mouth and dribbles down. A stands for arms or legs, only on one side. Sometimes it's one, sometimes it's both. Numb or tingly, or you can't feel it. S is speech. Slurred speech, garbled speech, you're saying the wrong word in response to things. And T stands for time. Time to call 911. The sooner you activate the 911 emergency system, the sooner we can hopefully intervene to stop the stroke. Whether it be an ischemic stroke or a hemorrhagic stroke, we want to stop it from happening. We want to stop it from causing damage. Now, the causes of the hemorrhagic stroke or the bleeding type of stroke include high blood pressure, aneurysms, AVMs, and blood thinners. So what is an aneurysm? An aneurysm is a weakening of the blood vessel wall where it balloons out or pouches. As it weakens, it becomes thinner and thinner, and there's more stress on it, and can start to bleed or even burst. An AVM is a cluster of abnormal blood vessels that you were born with, that you don't even know that you have, and that can cause increased pressure and cause bleeding. And blood thinners, of course, can cause bleeding, and you have to take them at the advice and under the care of your healthcare provider. The symptoms of a hemorrhagic stroke are a little bit different, but they're important to know. And sometimes they can get mixed in with the other symptoms as well. And of course, it's always sudden onset that worsens over time. And that would be the worst headache of your life, like a super migraine, neck pain, sensitivity to light where light bothers you, nausea and vomiting that you can't attribute to anything else, dizziness, confusion. These are all signs or symptoms. And please, please call 911. What is cholesterol? Cholesterol is a fatty substance that line the arteries within your body. Okay, keeping your cholesterol in the normal range prevents strokes and heart attacks. Now, the American Heart Association recommends anyone over the age of 20 gets their cholesterol checked. Now, if you look, this is what cholesterol looks like within a blood vessel. It narrows the lumen of the blood vessel. It can cause increased blood pressure because it's narrowing. It's got to pump through at a higher rate. Okay. They talk about different types of cholesterol, HDL and LDL, and triglycerides. HDL is the high density lipids, and the higher number is better. LDL is a low density lipids, and the lower number is better. And triglycerides vary according to age and sex. So what are risk factors for a stroke? There's things that we can do and things that we can't do. It's called modifiable and non-modifiable. The modifiable are things that we can intervene and change. Things like high blood pressure, high cholesterol, diabetes, atrial fibrillation, peripheral vascular disease or poor circulation in your legs, carotid artery disease, or buildup of plaque in your carotid arteries in your neck, smoking, illegal drug use, excessive alcohol intake, excessive weight, or inactivity. The non-modifiable factors include your gender, your race, your family history, a history of a prior stroke or a prior heart attack, a blood coagulation disorder, or even sickle cell anemia. So how can you prevent high blood pressure and a stroke? The most important thing is to understand what your risks are so you can minimize or change the risks. You can't change your family history or your hereditary profile, but what you can do is change what you do about it. See your healthcare provider regularly. Eat a healthy diet. Exercise. Don't smoke. Don't drink excessively. Take time for yourself to de-stress and take your medications as directed. It's important that you control your blood pressure. If you're on medication, please take it as prescribed. Get a blood pressure machine and keep a log of your blood pressure, especially when you're changing medications. They're adding or they're taking medications away. You want to make sure it's effective. Take your blood pressure in the same arm, the same time of the day if you can. Make it a routine. If your blood pressure is high despite the medications, call your healthcare provider. If you start to get side effects from the medication, call your healthcare provider. Now, when you log your blood pressure, write down if you have any symptoms. Are you dizzy? Are you tired? Do you have a headache? Did you call anybody? What did you do about it? Did you take an extra medication pill like your doctor told you if it's so high you should take another pill? Think about how to manage it yourself. Exercise. Stay active. Here at St. Barnabas, we have access to the Be Healthy Portable. Take advantage of it. Get reductions in your health insurance by getting points. Take the stairs, try walking at lunch, join a team, get information, understand your risks, and work towards improving your health. And it can also benefit you financially. When we talk about diets, the low sodium, low cholesterol diets, think about a diet that's low in sodium, low in cholesterol, and low in sugars. Read the labels to everything. They have to label things. And when you're out at a restaurant, look for the heart-healthy choices. That's also labeled with cholesterol and sodium. Most processed foods are high in cholesterol. There are now lower sodium options for cheeses and soups. You have to look for them. They are there. Choose fresh or frozen vegetables. Now, for people 51 or older, we recommend sodium less than 2,300 milligrams a day, or what we call 2 grams. So at the beginning, when you're starting a low sodium, low cholesterol diet, start to log how much sodium and cholesterol are in everything. Now, if you do have high blood pressure, coronary artery disease, if you're diabetic or have kidney problems, the number's lower. It's 1,500 milligrams a day. Many supermarkets have nutritionists that are free. You can make an appointment and they can help you provide healthier choices. Make a do or don't list. They can help you eat healthier. The next thing that you need to consider is controlling your blood sugar. Everybody is talking about an hemoglobin A1C. What is that? That is your blood sugar over a 3-month period of time, a measurement. It's in a percentage. We want to make sure that your blood sugar is not too high because it could be toxic to every organ system in your body. So when they talk about results of your blood sugar, they talk about the hemoglobin A1C, 5.7 to 6.4. They say you're at risk for developing diabetes. You can intervene at this point in time. You can change it. If your blood sugar in the hemoglobin A1C is 6.5 or higher, you probably already have diabetes and you don't know it and you're undiagnosed. Or maybe you do know it and you're trying to intervene and do the best you can. If you are a diabetic, your goal should be a hemoglobin A1C under 7. Now, cholesterol is the fatty substance that lines the arteries in your body. Remember, the HDL is the high density lipids, and higher is better. Generally, the optimal readings for HDL are men under 40 and men greater than 40 and women greater than 50. Now, the LDL, the lower is better, and the numbers vary depending on what your health risks are. If you have heart disease or you're diabetic, your LDL should be under 100, or if your healthcare provider advises you, under 70. If you have 2 or more risk factors, it should be under 130, or if your healthcare provider advises you, under 100. If you have no risk factor or only one, we recommend under 160. Triglyceride normal levels vary by age or sex, but generally under 150 is optimal. And what affects your triglycerides? Physical inactivity, cigarette smoking, a diet high in carbohydrates, and/or excessive alcohol consumption. High triglycerides, low HDL, high LDL is associated with atherosclerosis, which means fatty deposits in the artery walls that can increase your risk for a stroke or a heart attack. Smoking is another huge risk factor, and is something that we can change. Smoking deprives every body organ of oxygen. Even secondhand smoke affects us. And 1 to 5 cigarettes a day greatly increases your risk for heart disease. 1 out of 5 deaths from heart disease is related to smoking. And smoking places you at 2 to 4 times the risk of having a stroke. It has chemicals in that can harm the blood cells in your body. The arteries become less flexible. It leads to a plaque buildup or a cholesterol buildup in your arteries. It increases the clot formation. It lowers your HDL. It increases your blood pressure. It increases your heart rate. And it damages all the organs by depriving them of oxygen. Smokers have 30 to 40% higher risk for diabetes, increased risk for cataracts. Now, when we talk about smoking, we do include vaping and hookah as well. So I want you to think about that. Vaping and hookah are not better choices for smoking. Alcohol consumption is something else that needs to be considered. In healthy people, we recommend no more than 2 drinks a day or no more than 4 drinks at any occasion. Now, when you talk about the number of ounces for each type of spirit, it's important to understand. Now, spirits with 40% alcohol, an average drink is 30 milliliters or 1 ounce. Beer is 9.6 ounces or 1.1 drinks, and wine and champagne is 3.38 ounces. Most restaurants serve wine in about 3.38 ounces or greater than 100 milliliters. Excessive alcohol consumption raises your blood pressure, increases your risk for an abnormal heart rhythm, increases your risk for diabetes. It also depletes your body of all the good minerals that it needs and vitamins. It interferes with blood clotting, and it interferes with many medications. It's time to take control of your heart. Be engaged. Understand what's going on with you. Know and understand any medications you may be on. Keep a list. Keep track of your blood pressure, your hemoglobin A1C. Know your cholesterol numbers. Talk to your healthcare provider about any changes or any problems, whether they be physical or psychological. Work together. Decrease your stress. Did you know that prolonged stress can cause high blood pressure, a stroke, or a heart attack? What happens is when you're under chronic or prolonged stress, your body releases powerful chemicals that can increase your heart rate, raise your blood pressure, interfere with your sleep, either increase or decrease your appetite, raise your blood sugar, change your mood. You could be like anxious, depressed, jumpy, irritable. You need to take this seriously. It depresses your immune system after a while, interferes with the digestive system too. It affects everything. So what do we recommend? Taking time for yourself. Practicing mindfulness or thinking about some place that you like to go. Closing your eyes and visualizing that you're there. Listening to music, reading, doing something that you really enjoy doing. Socializing with others. Maybe even do yoga or some exercise. Those can all help with stress. Now, it's up to you. You can change your healthcare profile. You can interfere with your risk for stroke or heart attack. You can make a difference in your own life. It's time that we all get together. Let's be healthy. Thank you.